Let's start with the gastrointestinal system. First upon in GI, we will be going through with the abdominal evaluation. Whenever you are doing abdominal evaluation, you have to make your patient in a lie down flat position. Okay, upon lie down karana on a back, abdomen has to be up. Now, this is very commonly asked question. Select that all applied or drag and drop. ठीक है, ड्रैग एंड ड्रॉप बहुत कॉमनली आ सकता है बिकॉज देयर इज अ सीक्वेंस. ओके, ए वाला सीक्वेंस जो हुआ इंस्पेक्शन, अस्कल्टेट, परकशन एंड पल्पेशन. ए एब्डोमेन ਹੁੰਦਾ है, other organ will be having inspection, palpation, percussion and auscultation. Okay, IPPA, other organ. Okay, so we will not going to touch this part at all, otherwise you will be getting confused. So see, abdominal evaluation nu yaad rakho. First, what you are going to do, you are going to inspect. Okay? How I teach this, I always tell the nurses, ਜਦੋਂ ਵੀ ਤੁਸੀਂ inspection ਕਰਨੀ ਹੈ, you are going to do the inspection with the naked eyes. अपने हाथ पीछे रख लो. Okay, you are not going to touch the abdomen. Okay, then you are going to auscultate the abdomen. Okay, you are going to take the stethoscope and going to listen the bowel sound on each 4 quadrant. Okay, if you remember, अपन बहुत सारे part of the abdomen पढ़े सी. Okay, for NCLEX, just forget everything. सिर्फ याद रखना है, this is abdomen, this is right side, this is the left side, right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. That's it, we have to remember. ਆਪਾਂ हर quadrant पे stethoscope रख के की सुनांगे, bowel sound सुनांगे. Okay, you are going to listen this bowel sound complete for 1 minute. पूरा 1 minute ਆਪਾਂ सुनांगे. Okay, this is a 30 second, this is a 60 seconds. This is a start from 1. Why we have to listen full complete 30 seconds? Because sometimes you will get from 1 to 30 seconds, you may get a 5 to 20 sounds, which is a completely normal. Otherwise, 30 to 60 seconds, maybe you will not listen anything. That means you have 20 vowel sound in 1 minute. That is a normal. Okay. If it is a more than 20, okay, it's a hyperactive. Your patient's bowels are hyperactive. If there is a no sound, means there is a peristaltic ileus, means function nahi kar rahe abdomen, bowels. Okay, that will be there. Okay, so you have to listen whole complete 60 seconds. Sometimes first 20 seconds you will not have anything. Uto baad you have all 18 vowel sound. You may have 15 vowel sound. That's completely normal. Okay, so complete आपा सुनना है. All 4 quadrant आपा stethoscope रख के सुनना है. More than 20, normal कितने होने चाहिए? Up to 20. If it is a more than 20, is hyperactive. अगर कुछ नहीं है, it's a peristaltic ileus. Okay. Now next, what you are going to do? You are going to do the percussion to check the presence of fluid, distension, mass. Okay. Now on a percussion, you are going to hear this 2 things. Oh, sorry. I'm sorry. Okay. On percussion, ਤੁਸੀਂ ਕੀ ਸੁਣੋਗੇ? There is a name called as a timpani. Timpani is a high pitch sound, areas distended with the air. Okay. And then there is a dullness. Dullness is heard over a fluid and solid mass. Okay. ਹੁਣ percussion ਚ ਆਪਾਂ ਕੀ ਕਰਦੇ ਆ? Percussion ਚ ਆਪਾਂ, suppose this is my abdomen, ਮੈਂ abdomen ਦੇ ਉੱਤੇ ਹੱਥ ਰੱਖੂੰਗੀ, like this. I will keep the fingers, दूसरे हाथ ਦੀ finger ਨਾਲ tap 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 ਕਰੂੰਗੀ. Okay, on every quadrant. Okay, now ਜਦੋਂ ਮੈਂ ਏਦਾਂ ਕੀਤਾ, you may hear something. Okay, this sound you are going to hear. ਹੁਣ ਇਹ sound ਚ ਜਦੋਂ ਤੇ ਜਿਹੜੇ ਵੀ ਏਰੀਆ ਤੇ air ਆ, okay, you will listen high pitch sound. ਯਾਨੀ ਉਹਦੇ ਜਦੋਂ ਤੁਸੀਂ ਟੈਪ ਕਰੋਗੇ ਉਤੋਂ ਤੁਹਾਨੂੰ ਹਾਈ ਪਿਚ ਸਾਊਂਡ ਮਿਲੇਗਾ, ਯਾਨੀ ਉੱਥੇ ਏਅਰ ਆ। ਜਦੋਂ ਕਿਸੇ ਵੀ ਚੀਜ਼ 'ਚ ਆਪਾਂ ਪਾਣੀ ਭਰ ਦਈਏ ਜਾਂ ਉੱਥੇ ਕੁਝ ਸੋਲਿਡ ਹੋਵੇ, ਰਾਈਟ, ਜਦੋਂ ਆਪਾਂ ਉੱਥੇ ਟੈਪ ਕਰਦੇ ਆ, we will be hearing some dull sound. Okay, so that will be there. Okay? That is a percussion. Now next is a palpation. Palpation will be palpating the abdomen. Now this is your abdomen. ਆਪਾਂ ਏਦਾਂ ਕਰਕੇ palpate ਕਰਾਂਗੇ, ਆਪਾਂ feel ਕਰਾਂਗੇ ਕੁਝ. Okay, now for palpation, while palpating you have to observe the patient face. ਠੀਕ ਹੈ, patient ਦੀ ਤੁਸੀਂ feel ਕਰਨਾ ਹੈ ਹੱਥ ਨਾਲ ਔਰ patient ਦੇ face ਵੱਲ ਧਿਆਨ ਦੇਣਾ. Okay, now there is no sequence for palpation. ठीक है, and कोई sequence नहीं है कि right upper quadrant से चालू करके left lower quadrant तक आना. No. Then how you are going to do that? ठीक है, तानु कितना पता लगेगा कि मैंने पहला केड़ा part palpate करना है? You have to ask the patient, do you have any pain? अगर patient नु pain आ, then pain वाला area ਆਪਾਂ सब तो बाद च palpate करांगे. Okay, so what you are going to do? Ask the patient, do you have any pain? Pain वाला area last होएगा. ਹੁਣ ਆਪਾਂ ਜਦੋਂ palpate ਕਰ ਰਹੇ ਹਾਂ, ਹੱਥ ਨਾਲ feel ਕਰ ਰਹੇ ਹਾਂ ਕਿ any mass is there or any abnormality is there or not. Same time facial expression ਆਪਾਂ check ਕਰ ਰਹੇ ਹਾਂ pain ਵਾਸਤੇ. If you are palpated and patient have the pain, that means patient something is there, right? अंदर कुछ चल रहा है. Okay? Palpate the first at the point where the client don't have pain. Ask the client where he have pain in abdomen. Design your palpation according to the palpate the area of the pain at last. Okay, ਹੁਣ ਆਪਾਂ palpation ਕਿਚ ਨਹੀਂ ਕਰਦੇ. Do not palpate in a Wilms tumor. Okay, that will be there, which already we discussed. Now, why palpation is at last? अगर patient the abdomen pain है, okay, and if you palpate first, then patient will not allow you to do anything else. Okay, because patient the pain abdomen. That's why palpation in abdomen is a last one. Inspection, auscultation, percussion, then palpation. Okay. Now, let's see little bit anatomy and function of the organs in a GI. Liver is a highly vascular organ. Liver store 200 to 400 ml of blood. Liver helps in a bile production. Daily bile production will be 600 to 1200 mils. Bile helps in a emulsification of the fat. Okay, fat the digestion वास्ते अपन को bile the requirement होती है. Gallbladder stores 20 to 50 ml of the bile. जेड़ा bile बनिया वा ओदी storage किथे जाके होंदी है? Gallbladder. कितना approximately up to 20 to 50 ml of storage करता है. Okay, vitamin absorption ADE happens in a liver. Okay, liver functions again same, continue. Store glycogen, converts the glucose to the glycogen. अपन details देखेंगे while doing our insulin. Okay, fat is converted to glycerol and fatty acid, followed by the cholesterol and lipoproteins. This is when fat is getting digested. Protein metabolism, liver the help ਨਾਲ ਹੁੰਦਾ ਹੈ. Synthesis of clotting factor, vitamin K, the synthesis ਇੱਥੇ ਹੁੰਦਾ ਹੈ. If your patient's liver is not healthy, patient will have the bleeding disorder. Because क्यों bleeding disorder ਹੁੰਦਾ है? क्योंकि synthesis of clotting factor नहीं होया, vitamin K का synthesis नहीं होया. Okay, production and store of vitamin A, D, E, K, B12 and iron happens over here. Metabolism of alcohol, toxics and drugs happening. Okay, whenever your patient is not having good liver, they will not allow to take alcohol. Okay, and whenever patient is having bad liver, we are checking all drugs which all are getting excreted via the liver. We are avoiding that because इन्ना सब ਦਾ ਮੈਟਾਬੋਲਿਜ਼ਮ ਨਹੀਂ ਹੋਏਗਾ. ਮਤਲਬ ਮੈਟਾਬੋਲਿਜ਼ਮ ਯਾਨੀ ਆਪਣੀ ਜਿੰਨਾ ਰਿਕੁਆਇਰਮੈਂਟ ਬੋਡੀ ਨੂੰ ਆ ਉਹ ਰੱਖ ਕੇ ਬਾਕੀ ਵੇਸਟ ਬਾਹਰ ਕੱਢਣਾ ਉਹ ਨਹੀਂ ਹੋਏਗਾ. Already told bile production and emulsification of fat happening. Liver excretes the bilirubin into the feces. We all have the yellow color feces. क्यों हुआ? क्योंकि ਜਿਹੜਾ ਵੀ excessive bilirubin ਆ ਉਹ ਬਾਹਰ ਜਾਂਦਾ ਹੈ, liver excrete ਕਰਦਾ ਹੈ, and feces are getting turned into the yellow color. If the patient's liver is not healthy, ਉਹਨਾਂ ਦੇ feces ਚ yellow color bilirubin ਨਹੀਂ ਹੋਏਗਾ. So you are going to see some different color of the stool. Okay, spleen produce bilirubin. Okay, ਹੁਣ ਇਹ bilirubin ਬਣਦਾ ਕਿੱਥੇ ਆ? Spleen aqua. Okay, spleen is making bilirubin. ਹੁਣ ਇਹ bilirubin ਆਂਦਾ ਕਿੱਦਾਂ ਵਾ? ਜਦੋਂ RBC ਦਾ breakdown ਹੁੰਦਾ ਹੈ. Okay, red blood cells getting breakdown on a 120 days. ठीक है, 120 days हमने red blood cell ਦੀ life ਆ. ਹੁਣ ਜਦੋਂ life ਪੂਰੀ ਹੋ ਗਈ, ਉਹ ਕਿੱਥੇ ਜਾਂਦੇ ਆ? ਉਹ spleen ਚ ਜਾਂਦੇ ਆ. spleen ਚ ਉਹਨਾਂ ਦਾ breakdown ਹੁੰਦਾ ਹੈ. Okay, ਨਵੇਂ ਬਣਦੇ ਆ. ਹੁਣ ਜਦੋਂ ਉਹਦਾ breakdown ਹੋਇਆ, ਹੁਣ ਕੋਈ ਵੀ ਚੀਜ਼ ਆ, ਜਦੋਂ ਉਹਦੀ ਛਾਂਟੀ ਹੋਏਗੀ ਜਾਂ ਉਹਦਾ breakdown ਹੋਏਗਾ ਜਾਂ ਉਹ ਘਟੇਗੀ, ਉਹਦਾ ਇੱਕ end product ਬਣੇਗਾ. Okay, so spleen breakdown ਦਾ RBC, the RBC ਦਾ ਜੋ end product ਆ, that's a bilirubin. Okay, ਹੁਣ spleen ਨੇ ਤੇ bilirubin ਬਣਾਤਾ, ਉਹਨੇ ਨਵੇਂ RBC ਬਣਾਏ ਜੋ waste product ਸੀ, ਉਹਨੇ ਨਾਮ ਦੇਤਾ bilirubin. ਹੁਣ ਇਹ bilirubin is a waste product. Okay, bilirubin has to go out. ठीक है, ਹੁਣ ਕਿੱਦਾਂ ਇਹ out ਜਾਏਗਾ? Liver will help the bilirubin to show the door of exit from the body. So bilirubin liver को जाएगा, liver इन्हों बाहर send करेगा via the GI tract. Okay, that's the way this bilirubin comes in a body. Okay. Now we have albumin. Albumin is produced by the produced inside the liver. Albumin बनया, liver ने बनाया. Normal range of albumin is a 3.5 to 5.5. Now albumin da काम किया. Albumin helps to bind the fluid inside the blood vessels. Okay, ਹੁਣ ਆਪਣੇ blood vessels ਆ. ये अपने blood vessels ਆ. it's अपने blood is running. We have cell and we have everything. Okay, इथे fluid भी आ. Yeah, we have fluid. Okay, ਹੁਣ ਇਹ fluid inside the blood vessels कितना रह रहे हैं? Okay, now cells and blood vessels are the having a semi-permeable membrane, right? यहाँ पर details से देखेंगे related to semi-permeable membrane and movement of the fluid in the IV fluids. Okay, now this fluid has to get binded. ये इन्हों blood vessel दे अंदर ही रखना है. वो कौन करता है? Albumin करता है. ठीक है, this is our albumin. Okay, ये albumin गया liver तो इन्हें सारे fluid नो bind करता. ठीक है, so this will be staying inside the blood vessels. Okay, अगर if low or no albumin, okay, अगर अल्बुमिन नहीं है, नो अल्बुमिन, ओके, और लो अल्बुमिन, what is going to happen? जेड़ा भी आ फ्लूइड आ, it going to come outside of the vessels. ठीक है, वो बाहर आ जाएगा. ठीक है, बाहर कितने आ जाएगा? It comes in a tissues. ओके, अपने टिश्यूज आ जाएंगे एंड देन पेशेंट विल हैव द एडिमा, ड्राई स्किन, वॉमिटिंग, nausea and diarrhea. This is called as a hypoalbuminemia, यानी ब्लड च लो एल्बुमिन, हाइपोएल्बुमिनिया. सो सारा फ्लूइड बाहर आ गया, इथे कुछ भी नहीं रहा, एल्बुमिन नहीं रहा, सो पेशेंट विल हैव हाइपोएल्बुमिनिया, which is very common in a liver disease. लीवर डिजीज क्यों कॉमन है? लीवर ने कुछ भी एल्बुमिन बनाया नहीं, वेसल से एल्बुमिन गया नहीं, वेसल से एल्बुमिन कट्टा, फ्लूइड ने की कितना सारा बाहर आ गया. Okay, this is very common again in a burns patients also. जब भी burn होता है, patient is getting swollen up, fluid बाहर accumulate हो जाता है, right? That's the reason. Then we have to give the albumin. Albumin आपा देना है. Okay, what is the treatment of hypoalbuminemia? We are infusing the albumin. Okay, albumin infusion देवांगे, नाल diuretics देंगे. हुन आपा diuretics क्यों दे रहे हैं? ठीक है, हुन आपा ने दिता, आपा एल्बुमिन देता. ओके, लीवर ने एल्बुमिन नहीं दिता, आपा आउटसाइड तो एल्बुमिन इंसर्ट किया. हुन वापस सारा फ्लूइड अंदर बाइंड हो गया. ओके, वेसल्स प्रॉपर हो गया एल्बुमिन, बट नाउ दिस फ्लूइड इनू आपा रिमूव करना है. ये वापस ते जाएगा नहीं, इनू किद्दां रिमूव करांगे? बाय डायरेटिक्स. ये सारा फ्लूइड नो डायरेटिक्स अपनी वाल खींचेगा एंड वाया द किडनी बाहर सेंड कर देगा. दैट्स व्हाई वी आर गिविंग विद द डायरेटिक्स. ओके, हाइपोएल्बुमिनिया द ट्रीटमेंट इज द albumin infusion with the diuretics. Okay. Now let's see some of the clinical manifestation of liver diseases. Whenever patient have the liver disease, what they are going to have? Caput medusa is a varicose vein in abdomen. As you see in the picture, patient the abdomen te veins दिखेगी, बहुत prominent. You can see the veins. Caput medusa is the name of the cluster of swollen veins in patient abdomen. Wherever you see your, just consider as a patient. अपने नहीं है, patient दे. Esophageal varices. Esophageal varices are the enlarged vein in the esophagus. They are often due to the obstructed blood flow through the portal vein. Okay. Now, when it is key hunda hai, portal vein is a heart. Yeah. Heart to aorta nikal hai. Okay. Aorta is coming, descending aorta, thale di taraf aaya, ascending aorta, utte di brain no blood supply denda hai. Okay, brain and upper body. Jeda aorta is the biggest vessel in our body, right? When aorta aaya thale, abdomen aaya. In abdomen, this is called as a portal vein. Okay, portal vein. Again, this is a big vein. When ida काम किया, ida काम liver no blood supply देना. Sorry. Okay, ida काम liver no blood supply देना. Liver is a highly vascular organ, right? Liver required a very, very good blood supply. Because as you see, this is a portal vein. Okay? And then liver no blood supply देना, stomach no देना, and then it go descending and supplying to the pelvic organ. अपने kidney हो गए and reproductive हो गए, उन supply करेगा. So this is a very big vein. Okay, बहुत मोटी vein है, क्योंकि बहुत ज़्यादा blood supply चाहिए बड़े organ वास्ते. So what happening if the patient have portal obstruction in a portal vein? So if there is a obstruction somewhere, suppose इथे कुछ obstruction है portal vein, okay, blood flow इथे वापस नहीं जाएगा, right? So एक concept समझ लो, ਜਦੋਂ ਵੀ ਕਿਸੇ ਵੀ ਚੀਜ਼ ਤੇ ਪ੍ਰੈਸ਼ਰ ਹੁੰਦਾ ਹੈ, ਕਿਸੇ ਵੀ ਬੋਡੀ ਪਾਰਟ ਤੇ ਪ੍ਰੈਸ਼ਰ ਆ, that pressure is going to what is it? That pressure will go to some other place also. ठीक है, ਇਦਾਂ ਸਮਝੋ ਐਗਜ਼ਾਮਪਲ ਤੁਹਾਡੇ ਕੰਮ ਤੇ ਪ੍ਰੈਸ਼ਰ ਆ, ਠੀਕ ਆ, ਬਹੁਤ ਪ੍ਰੈਸ਼ਰ ਆ, ਆਪਾਂ ਕੰਮ ਤੋਂ ਆਏ ਆਪਾਂ ਚਿੜਚਿੜ ਹੋ ਜਾਂਦੇ ਆ, ਆਪਾਂ ਕੀ ਕਰਦੇ ਆ, if we are good into management, we manage sometime, ਅਗਰ ਆਪਣੀ ਕੈਪੈਸਿਟੀ ਤੋਂ ਬਾਹਰ ਹੋ ਜਾਏ ਪ੍ਰੈਸ਼ਰ, we may had a fight with the family members, right? ਆਪਾਂ ਉਹ ਪ੍ਰੈਸ਼ਰ ਆਪਣੇ ਫੈਮਿਲੀ ਮੈਂਬਰ ਨੂੰ ਦੇ ਦਿੱਤਾ, ਆਪਣੇ ਹਸਬੈਂਡ ਨੂੰ ਦੇ ਦਿੱਤਾ, ਪੈਰੈਂਟਸ ਨੂੰ ਦੇ ਦਿੱਤਾ, ਬੱਚੇ ਨੂੰ ਦੇ ਦਿੱਤਾ, ਓਕੇ, ਸੋ ਪ੍ਰੈਸ਼ਰ ਆਪਾਂ ਨੇ ਦਿੱਤਾ ਕਿਸੇ ਹੋਰ ਨੂੰ। Same thing happening in our body also. Whenever there is a pressure, ਅਗਰ ਉਹ ਏਰੀਆ ਆਪਣਾ ਪ੍ਰੈਸ਼ਰ ਨਹੀਂ ਸੰਭਾਲ ਪਾਉਂਦਾ, ਉਹ ਦੂਸਰੀ ਚੀਜ਼ ਨੂੰ ਪ੍ਰੈਸ਼ਰ ਦਿੰਦਾ ਹੈ। ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਉਹ ਕਿਹਨੂੰ ਦੇਗਾ? ਛੋਟੀਆਂ ਚੀਜ਼ਾਂ ਨੂੰ ਦੇਗਾ, ਜਿਹੜਾ ਰਿਲੇਟਡ ਆਰਗਨ ਆ ਲੇਕਿਨ ਸਮਾਲ ਆ, ਕਿਉਂਕਿ ਉਹ ਵਿਚਾਰਾ ਸਮਾਲ ਆਰਗਨ ਕੁਝ ਬੋਲ ਨਹੀਂ ਪਾਏਗਾ, ਰਾਈਟ? So it's giving pressure on a small organs. Now in a portal vein hypertension or obstruction, what happening? Esophagus happening, small veins ਹੁੰਦੀਆਂ, okay, this is the esophagus, and esophagus ਇੱਕ small veins blood supply ਕਰਦੀਆਂ, tiny blood vessels ਹੁੰਦੀਆਂ, ਇੱਥੋਂ ਜੇ pressure ਜਾਏਗਾ ਇਹ small vessels ਤੇ, okay, and this small vessels will start getting dilated or enlarged, or they are getting bleed, ਠੀਕ ਹੈ। ਪਹਿਲਾਂ ਉਹ ਆਪਣੇ ਆਪ ਨੂੰ ਕੰਟਰੋਲ ਕਰਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰੇਗੇ, ਅਗਰ ਉਹ ਨਹੀਂ ਕੰਟਰੋਲ ਹੋਇਆ, they will be burst and they will be start bleeding, okay, that's why the esophageal varices are enlarged in the esophagus. They are often due to the obstructed blood flow through the portal vein. What will be the sign and symptom? Hematemesis, patient ਦੀ vomitus ਹੋਏਗੀ, blood ਹੋਏਗਾ, vomitus, patient will have melena, blood in stool, because ਇੱਥੋਂ ਜੇ blood ਅਗਰ ਇਹ bleed ਕੀਤੀਆਂ, where blood will go, blood will come into the stomach. ਅਗਰ patient ਨੇ vomit ਕੀਤਾ ਤੇ ਉਹ ਬਾਹਰ through the mouth ਆਏਗਾ, ਅਗਰ bleeding, ਅਗਰ patient ਨੇ vomiting ਨਹੀਂ ਕੀਤੀ, this blood will go get digested and it will come out of the, it will come with the feces, that's called as a melena. Then patient will have the ascites, they will have the accumulation of fluid. Then there will be the jaundice, hepatomegaly and splenomegaly will be there. This hepatomegaly is an enlargement of the liver, and splenomegaly is an enlargement of the spleen will occurs. Dilated abdominal veins will be there, and sign and symptoms of shock will be there. Sign and symptoms of shock बहुत common है ਜਦੋਂ rupture ਹੁੰਦਾ है. There is a rupture and resultant hemorrhage of the esophageal varices is the primary concern because it's a life-threatening situation. जब अगर rupture हो गया, it will be life-threatening situation. Okay? We are going to see the esophageal varices detailed in upcoming slides. Okay. Now, next problem will be patient have the palmar arrhythmia. Palmar arrhythmia is a skin condition that makes the palms of the hands turns to the red. As you see, एक side the red होएगा, which yellow होएगा, फिर red होएगा. Patient will have the female patient will have the absence menstruation, and there will be the lack of sexual drive in men. And men's testicular atrophy भी होएगा. Okay, testes will be shrunken. Now, let's see about the hepatitis. Hepatitis is inflammation of the liver, releases the ALT and AST in the blood. Okay. Again, no need to go in a detail of what it is. Main ਇਹਦੇ ਚ ਆਪਾਂ ਨੂੰ precautions are. Okay. What precaution you are going to give to the patient? Hepatitis A is a fecal oral route. Okay, fecal oral route, it gets transmitted. Now, what it means, if contaminated food or water lavange, it will go in our GI tract. We will be getting disease, and we are going to release infection via our stool. And agar wo stool na food and water contaminate hunda, or someone else nu jayega. Okay. Now for treatment, there is a routine vaccine IgG we are giving. और ਇਹਦੇ ਚ ਆਪਾਂ contact precaution ਲੈਂਦੇ ਆ patient ਨੂੰ. Okay, that will be there. Now hepatitis B. B for blood. So it is a blood related hepatitis. ਹੁਣ Spread ਕਿੱਦਾਂ ਹੁੰਦਾ ਹੈ? Contaminated needles, ear piercing, tattooing, IV drug user or sexual contacts. ਜਿੱਥੇ ਵੀ ਆਪਣੇ ਨਾਲ blood ਦਾ contact ਹੋਣ ਦੇ chances ਆ, ਉੱਥੋਂ ਹੀ ਆਪਾਂ ਨੂੰ hepatitis B ਹੋ ਸਕਦਾ ਹੈ patient ਨੂੰ ਜਾਂ ਆਪਾਂ ਨੂੰ. Okay. Now what will be the treatment? HBV vaccine, immunoglobulin will give. Otherwise there is no other treatment. And in this we have to give the standard precaution. Yani, whenever we are doing any procedure, according to the procedure, we have to follow the standard precaution, but anytime we have to wear anytime we have to do the hand hygiene, okay? Hepatitis C is the same as B, okay? Blood borne here, blood de nali apan nu hunda hai, okay? Over here we are giving antiviral interferon injection. Precaution again, standard precaution will be there. So in a hepatitis, you will be expected to know the what precaution you are going to give to the patient. That's all. Okay. If it is a bloodborne, standard precaution. If it is a fecal, your contact precaution will come. Okay. And now next is a liver cirrhosis. What happening with the liver cirrhosis? There is a scarring of the tissues occurring in the liver. ठीक है, जेडे liver the tissues ਹੁੰਦੇ ਆ, scar ਆ ਜਾਂਦਾ. Why the scars are coming? Because of chronic destruction of the liver cells. यानी बहुत पुराने, it's a chronic, right? It's a chronic destruction. Liver cell मर रहे हैं. Okay, when liver cell क्यों मर रहे हैं? Destruct क्यों हो रहे हैं? Because of the alcohol use. It can be biliary obstruction or infection. Okay, it can be any of that. Now, upon this patient the assessment ki karange. There is a ALT. It's a test we do. Alanine, transminin will be the high. Okay. Again, you are not expected to memorize the normal range. Don't worry, they are not going to give. Next is a AST. Aspartate transminase will be high. AST, ALT दोनों high होएगा. तो ये SGOT, SGPT सुनिया होएगा, right? It's the same thing. ठीक है, ये high होएगा. SGOT, SGPT will be high. Now, what will be the risk? Risk will be the low albumin. Jaundice will be the risk. Bilirubin under the skin, like jaundice. क्योंकि bilirubin हर feces, bilirubin GI tract वाल नहीं गया, कितने bilirubin जाएगा? It's getting accumulated inside the body. ठीक है, जब bilirubin अपनी body ही accumulate होता है, we can see it comes under the skin and then skin becomes yellow in color. Patient में pruritus होएगा, okay, and patient will have the itching on a skin. Okay, so we have to give the good skin care. There will be the obstruction of portal vein circulation, portal hypertension होगी. Portal hypertension होने करके what all will be the complication, and complication of cirrhosis of liver will be the esophageal varices. Okay, ascites, hepatic encephalopathy. Okay, now जेड़ा bilirubin आ वो skin दे body दे अंदर ही आ. Okay, अगर आप timely treatment नहीं कीती, it will go to the brain. That's called as a hepatic encephalopathy. Okay, esophageal varices and all we are going to see in a detail again. Now, what will be the clinical manifestation? Patient, the sign and symptoms की होएंगे. Patient will early will be flu-like symptoms, fever, anorexia, nausea, and vomiting. Late will be the jaundice, tea-colored urine. One of major function of the liver is to produce the clotting factor. Okay. Liver damage will be having the bleeding. Okay. So what happening? Why this tea color urine is coming? Because one clotting factor nahi hai. So inside somewhere is bleeding is happening. So urine is content of the blood. So that's why tea colored urine will be there. Okay. Now, what will be the management of cirrhosis of liver? Antacid, that means diuretics, paracentesis for removal of the water from the peritoneal cavity, ascites ਜਦੋਂ ਉਹਨੂੰ skin care for pruritus, low protein, low sodium diet, strict IO chart, and daily weights. We have to do bleeding precaution because vitamin K nahi hai, there is a risk of patient to have bleed. Careful with the drug doses, metabolize if is affected, so decrease the doses. Okay, now we have to see all drugs. If we can avoid whichever drug is getting metabolized by liver, we have to avoid that. If we can't avoid, then we have to decrease the dose of the drug. Okay, now especially drugs like narcotics and acetaminophen, we have to be very careful. Okay? Now, complication is the esophageal varices, dilated and tortuous vein in the submucus of the esophagus caused by the portal hypertension, often associated with the liver cirrhosis, are at the high risk of rupture okay, portal circulation pressure arises. Now, what happening? There will be the bleeding varices are emergency. Okay, agar a bleed, I already explained what is a esophageal varices. I will not go. Only we will see main point here. So if it is bleeding, then it will be your emergency. The goal of treatment is control the bleeding, prevent the complication, and prevent the reoccurrence of bleeding. ठीक है? ਹੁਣ ਆਪਾਂ ਨੇ ਜੋ treatment ਦੇਣੀ ਆ ਉਹਦਾ ਸਭ ਤੋਂ ਪਹਿਲਾ goal ਆ bleeding ਨੂੰ ਰੁਕਾਣਾ, bleeding ਤੋਂ ਹੋਣ ਵਾਲੇ complication ਨੂੰ ਰੁਕਾਣਾ, ਫਿਰ bleeding ਨਹੀਂ ਹੋਵੇ ਉਹਨੂੰ prevent ਕਰਨਾ. Now, what all need to be avoided? Avoid any activity that causes bleeding. ਹੁਣ ਕਿਹਦੇ ਨਾਲ bleeding ਹੋ ਸਕਦੀ ਆ? Straining. ਠੀਕ ਆ? ਆਪਾਂ ਕਰਦੇ ਹੋ ਨਾ? That will be Valsalva maneuver, coughing, sneezing, vomiting, heavy weight lifting, wearing a tight clothing. Okay, this is very important. Highlight this in your notes. Okay, the question is expected on a select that all apply. Okay, now what will be treatment we are going to do? We are going to put a Sandstein Blackmore tube. Now what this tube is? Okay, it's a temporary measure to stop the bleeding. देखा कि patient को bleeding ना हो गए, temporary measure is a three-way lumen catheter. Okay, I will just first read and then I'll explain. It's a three-way lumen catheter. First will be the esophageal balloon inflation sphygmomanometer 25 to 40 mm Hg. Second is a gastric aspiration suction. It will be on a suction machine less than 2 mm Hg. Third will be the gastric balloon inflation syringe 100 to 200 cc of air. Okay, ਹੁਣ ਇਹ ਹੈ ਕੀ exactly? Okay, so let's see. Yeah. Okay. As you see, एक nose तो tube अंदर गई है and it goes like सीधा सीधा अंदर जाके stomach तक गई है. Okay. ਹੁਣ ਇਹਦੇ 3 lumens are. I will write here only 1, 2, 3. Okay, ਜਿਹੜਾ ਤੇ esophageal varices, esophageal balloon ਆ ਇਹ ਇੱਥੋਂ ਜਾ ਕੇ ਠੀਕ ਆ ਆ balloon ਆ ਇਹਨੇ ਕੀ ਕੀਤਾ ਜਿੱਥੇ ਇੱਕ esophagus ਆ there is a varices are there ਜਿੱਥੇ bleeding ਹੋਣ ਦੇ chances ਆ ਉੱਥੇ ਜਾ ਕੇ ਆਪਾਂ ਨੇ ਇਹਨੂੰ inflate ਕਰਤਾ. Okay, now whenever we are having bleeding ਠੀਕ ਆ ਅਗਰ ਆਪਣਾ ਹੱਥ ਕੱਟ ਗਿਆ okay, first response ਕੀ ਹੁੰਦਾ ਆਪਣਾ ਆਪਾਂ ਇਹਨੂੰ hold ਕਰਦੇ ਹਾਂ. Right, we are holding like this. Why we are holding like this? Because we are putting a pressure, so all clotting factor will come on that cut and will stop the bleeding. ठीक है? ਆਪਾਂ pressure ਦਿੱਤਾ. Same way ਆਪਾਂ ਇੱਥੇ pressure ਦੇਣਾ ਹੈ. ਹੁਣ ਆਪਾਂ pressure ਹੱਥ ਨਾਲ ਤੇ ਦੇਖ ਨਹੀਂ ਸਕਦੇ ਕਿਉਂਕਿ it's in our inside, right? ਤਾਂ ਕਰਕੇ ਆਪਾਂ ਬਲੂਨ ਨਾਲ ਇਥੋਂ ਪ੍ਰੈਸ਼ਰ ਦਿੱਤਾ, ਜਿਹੜੇ ਵੀ ਇਹਦੇ ਬਲੀਡਿੰਗ ਦੇ ਕਾਜ਼es ਆ ਉਹਨਾਂ ਨੂੰ ਆਪਾਂ ਪ੍ਰੈਸ਼ਰਾਈਜ਼ ਕਰਤਾ with the esophageal balloon. Okay, that's your first tube is doing. What your second tube is doing? Okay, your second tube is going, इथों गई, right? It going in a abdomen. Okay, ओदा end आवा. Sorry, not in abdomen, it's going in your patient's stomach. Or the end area. Yeah. This is, we are aspirating. क्योंकि अपन को empty चाहिए. Okay, patient is on a nil by mouth and we required stomach has to be empty. ਤਾਂ ਕਰਕੇ ਆਪਾਂ ਇਹਨੂੰ suction ਤੇ ਪਾ ਦਿੰਨੇ ਆ. That will be low suctioning, continue low suctioning, less than 2 mmHg ਤੇ pressure ਹੋਏਗਾ. Okay. Now, what is the third opening doing? Purpose of third is a gastric balloon. Okay, ਹੁਣ ਇਹ ਵਾਲੀ third ਜਾਂਦੀ ਹੈ ਇਥੋਂ ਜੀ ਗਈ, and ਇੱਥੇ ਜਾ ਕੇ ਆਪਾਂ ਨੇ balloon inflate ਕਰਤਾ. Okay, ਤਾकि ਇਹ stomach 'ਚ ਹੀ ਰਹੇ. Okay, it will place in a stomach only. ਆਪਣੀ ਜਗ੍ਹਾ ਤੋਂ हिले ਨਹੀਂ. balloon inflate ਕਰਨ ਨੂੰ ਆਪਾਂ air install ਕਰਦੇ ਹਾਂ. 100 to 200 cc of air ਆਪਾਂ syringe ਨਾਲ inflate ਕਰਦੇ ਹਾਂ. Okay, that is a Sengstacken's Blackmore tube. Okay, now your patient is on a Sengstacken's Blackmore tube. What will be the complication they will be having? Okay, they may have the respiratory distress. Now, why this respiratory distress will be there? This esophageal balloon may press the lungs. Okay, so that's why patient may have the respiratory distress. Okay, now in a respiratory distress, what will be your priority? If your patient have the bleeding and if your patient have the respiratory distress, what will be your priority? ਤੁਹਾਡੀ priority ਕੀ ਹੋਏਗੀ? ਕਿਹਨੂੰ ਤੁਸੀਂ ਪਹਿਲਾਂ treat ਕਰੋਗੇ? Tell me. ਹਾਂਜੀ. Yeah, your priority will be the respiratory distress. Correct. Okay. फिर अपन ने की करना है? If your patient is having a sign and symptoms of respiratory distress, you have to remove this tube. ठीक है? अगर तुसी ये remove करोगे manually, 200 cc तुसी air इथे insert कीती है, you are going to remove that air. It will take some time. In respiratory distress, you don't have time. It's a medical emergency. So what you have to do, you have to cut this tube. ठीक है, ਆਪਾਂ ਨੇ ਆ ਟਿਊਬ ਸੀਜ਼ਰ ਨਾਲ ਕੱਟ ਕਰ ਦੇਣੀ ਆ. ਜਿੱਦਾਂ ਹੀ ਤੁਸੀਂ ਸੀਜ਼ਰ ਨਾਲ ਕੱਟ ਕੀਤਾ, ਜਿਹੜੀ 에ਅਰ ਆ ਉਹ ਬਾਹਰ ਆ ਜਾਏਗੀ and this will be all deflated. ਫਿਰ ਆ ਜੋ ਵੀ ਤੁਸੀਂ ਇਨਫਲੇਟ ਕੀਤਾ ਸਾਰਾ ਕੁਝ ਪੁਚਕ ਕਰ ਜਾਏਗਾ. Okay, ਸਾਰਾ ਕੁਝ ਹਵਾ ਬਾਹਰ ਚਲੀ ਗਈ. Then whatever this tube is giving stress will be getting released. So what you are going to keep? You are going to keep a Caesar at the bedside. Okay. Now in your notes, अपने notes एक column बना लो bedside articles. Notes बना लो या एक बड़ा sticky note ले लो, whatever you do. Write it down, bedside articles. ओदे च लिख लो GI Sengstacken tube Caesar. ठीक है, याद रहेगा. Like this, you can make a note. Yeah. So, whenever you have to Sengstacken's Blackmore tube, Caesar will be your bedside article. ठीक है? Now, this is a temporary measure. Now, what will be the surgical measure? So, long time, like permanent cure for treatment for this will be the surgical measure. Surgical measures are endoscopic injection, that's called as a sclerotherapy ਆਪਾਂ ਕਰਦੇ ਆ. ਜਿਹੜੇ ਵੀ viruses ਆ ਆਪਾਂ ਉਹਦੇ ਚ injection insert ਕਰਦੇ ਆ, so they will not be bleeding. Okay. Another is a endoscopic varicose ligation. यानी ਆਪਾਂ ਨੂੰ ਨਾ ligate ਕਰ ਦਿੰਦੇ ਆ. Okay. So that will be there. ਆਪਾਂ ਨੂੰ ਬੰਨ ਦਿੰਦੇ ਆ. Okay. Again, this is not important, so don't worry. But while doing question bank, you may see some question on this. Do that question, but again, I'm telling that is not important, but you should know what it is, right? Now, another procedure is shunting procedure. Shunting ਚ ਆਪਾਂ portal vein ਨੂੰ shunt ਕਰਦੇ ਆ, ਉਹਦਾ ਜੋ pressure ਆ ਉਹਨੂੰ cut ਕਰਦੇ ਆ. Okay, that is there. Next problem is ascites. Ascites is a fluid accumulation in a peritoneum cavity. Now, we have to do the paracentesis, removal of excessive fluid from the abdomen. Now, what will be the goal of treatment? Goal of procedure will be the relieve the dyspnea. क्योंकि peritoneal cavity से fluid accumulate हो गया, so patient will have the big abdomen. उन्हें big abdomen की कर दिया, diaphragm ने ऊपर push कर दिया, patient will not have the proper space for lungs for expansion. अगर lungs की space कोई ले लेगा तो lungs dyspnea जाएंगे, they will be having problem. Okay. Position will be the semi-polar or sitting upright position. Whatever patient feel good, we can give the position. Normal to drain at least 2 to 3 liters as per the doctor advice. Before procedure, give neomycin antibiotic prophylaxis to decrease the GI bacteria to prevent the infection. During the procedure, monitor the blood pressure and watch for hypotension. Okay, ਜਦੋਂ ਵੀ ਆਪਾਂ ਕੋਈ ਵੀ fluid ਬਾਹਰ ਕੱਢਦੇ ਹਾਂ body ਚੋਂ, patient is more prone for the hypotension, so we have to watch for hypotension. Post procedure, give IV albumin plasma protein to promote the osmotic pressure, pulling force, ताकि जो fluid वा वो blood ਦੇ ਵਿੱਚ ਰਵੇ, sorry blood vessels ਦੇ ਵਿੱਚ ਰਵੇ. Okay, so we have to give the IV albumin. Okay. Accumulation of fluid in peritoneal cavity treatment. Okay. Now we done the paracentesis and we are giving the albumin also. Okay, this is just I put one line for you guys to remember. Next is the hepatic encephalopathy. Okay. किसका पति? Liver का पति. Okay. Hepatic encephalopathy. Increase ammonia level in the blood which cross the blood-brain barrier. Okay. Protein in a diet is break down into the ammonia. Liver convert this ammonia into the urea. Kidney excrete urea. Due to the liver inflammation, ammonia build up instead of being converted to urea. Increase ammonia level causes a hepatic coma. Okay, I just read, now I'll explain this. Hepatic encephalopathy is given that we have something in our body that's the ammonia level. Okay, जब ammonia level body blood increase होती है. I think in just let me go back again. I think I just told you something which is not meant to say. Okay, मैंने थे ना bilirubin बोले से bilirubin increase होएगा तो it goes to the brain. No, it's ammonia. It's my mistake. मैंने ammonia बोला से, but it comes in a constant. Instantly bilirubin आ गया, but encephalopathy is ammonia. ठीक है? Correction. That's my mistake. Okay, sometimes it happened. Okay, now let's move on. Hepatic encephalopathy. Okay, so in hepatic encephalopathy there is a ammonia. ਹੁਣ ammonia ਆਇਆ ਕਿੱਥੋਂ? So ਆਪਾਂ ਚਾਲੂ ਕਰਦੇ ਹਾਂ ammonia body ਚ ਕਿੱਥੋਂ ਆਇਆ? ਜਦੋਂ ਵੀ ਆਪਾਂ protein ਲਿੱਤਾ, okay, we taken the protein in our diet. Okay, protein ਦਾ breakdown ਹੁੰਦਾ ਹੈ ammonia ਚ. Okay, protein ਨੇ ਦਾ ਜਦੋਂ breakdown ਹੋਇਆ ਉਹਨੇ ammonia ਬਣਾਤਾ. जिन्ना ते प्रोटीन अपनी बॉडी ਨੂੰ रिक्वायर्ड आ वो एज अ प्रोटीन चला जाएगा. जो ਉਹਦਾ ਵੇਸਟ ਆ, ਓਕੇ, ਐਂਡ ਪ੍ਰੋਡਕਟ ਆ, ਇਟਸ ਅ ਵੇਸਟ ਜੋ ਬੋਡੀ ਨੂੰ ਰਿਕੁਆਇਰਡ ਨਹੀਂ ਆ, ਉਹਨੂੰ ਆਪਾਂ ਅਮੋਨੀਆ ਬੋਲਦੇ ਆ, ਠੀਕ ਹੈ। ਨਾਓ ਦਿਸ ਅਮੋਨੀਆ, ਇਹ ਤੇ ਬਣ ਗਿਆ ਆਪਣੇ GI tract ਦੇ ਉੱਥੇ। So now this ammonia will not able to go out, जो GI tract ਆ, ठीक है, वो अमोनिया ਨੂੰ exit नहीं कर सकता, because this ammonia is a very naughty, ठीक है, GI ਨੂੰ नहीं exit कर सकता, but इन्हें बाहर जाना है, फिर ये बाहर कितना जाएगा, because it is not supposed to be stay inside, right? ਹੁਣ ਕੀ करेगा, लीवर जो आ, okay, liver will take this ammonia from the GI tract, GI ਨੂੰ बोलेगा okay give me this ammonia, ठीक है। ਜਦੋਂ ਇਹ अमोनिया लीवर को आया, okay, again liver is a part of GI tract, ਉੱਥੋਂ exit नहीं हो सकता, फिर लीवर ਕੀ करेगा कि अमोनिया ਨੂੰ कन्वर्ट कर देगा यूरिया ਚ, ठीक है। ਹੁਣ ਉਹਨੇ बोलता कि चलो मैं ਇਹਨੂੰ यूरिया बना देना है, again this urea will not go exit by the GI tract, same thing happening, ठीक है, क्योंकि ਇਹਦਾ ਹੀ ਬੱਚਾ ਹੈ ਨਾ, ਅਮੋਨੀਆ ਦਾ ਹੀ ਬੱਚਾ ਹੈ यूरिया, ओके, GI ਤੋਂ ਬਾਹਰ ਨਹੀਂ ਜਾਏਗਾ। ਫਿਰ ਕੀ ਹੁੰਦਾ ਹੈ, kidney is a Purging organ, okay, when I say Purging organ, we all are females, kidney also females, female have very सॉफ्ट हार्ट, ठीक है, किडनी का बहुत सॉफ्ट हार्ट आ, किडनी को देखा नहीं जाता कि ये यूरिया बॉडी चा लीवर नो जीआई नो ट्रबल कर रहा है, सो किडनी विल टेक दिस यूरिया, ओके, किडनी लेगी एंड विल एक्सक्रीट इन अ यूरिन, ओके, किडनी ने नु बाहर करता, प्रोटीन दा बनिया अमोनिया, अमोनिया दा बनिया यूरिया इन लीवर, लीवर ने यूरिया नु बनाया, यूरिया गया किडनी को, किडनी ने यूरिया नु ले लिया, लेके यूरिन ने वाया सेंड करता बाहर, ओके, दिस इज अ नॉर्मल थिंग्स, ये सारा अपना नॉर्मल फंक्शन, अपनी मशीन इदा ही काम करती है। नाउ व्हाट हैपनिंग, लीवर इन अ बैड शेप, ठीक है, due to liver inflammation, ammonia built up instead of converted into the urea, ਹੁਣ ਇਹ ਲੀਵਰ ਆਪ ਹੀ ਬਿਮਾਰ ਆ, ਤੇ GI ਤੋਂ ਲਏਗਾ ਨਹੀਂ ਲੈ ਰਿਹਾ, ਬੋਲਦਾ ਮੈਂ ਨਹੀਂ ਲੈ ਸਕਦਾ, ਸੌਰੀ ਬॉस, I'm not going to work anymore, okay, ਫਿਰ ਅਮੋਨੀਆ ਕਿੱਥੇ ਰਹੇਗਾ, ਅਮੋਨੀਆ increase ਹੁੰਦਾ ਜਾਏਗਾ, okay, this ammonia have the power to cross the blood brain barrier, ठीक है, GI ट्रैक्ट तो ब्लड से जाएगा, ब्लड तो जाएगा ब्रेन, ठीक है, होने चला गया, मतलब ठीक है जी, तुसी अपना लीवर ना सुधारो, मैं तो चला ब्रेन में, ठीक है, मैं चला गया ब्रेन, इथे जाके बैठ जाएगा, ओके, then patient will have the hepatic encephalopathy, and when it increases, then there will be the coma, patient will have the altered level of consciousness, patient will have the confusion, okay, because हम brain काम नहीं कर रहे हैं, because अमोनिया ने जाके उसे अपना घर बना लिया, okay, that will be clear. Clear how from where ammonia comes, कित्थे बनया यूरिया, कित्थों बाहर गया, अगर लीवर काम नहीं करता, अमोनिया इंक्रीज होएगा, ब्लड ब्रेन बैरियर क्रॉस करेगा, ब्लड ब्रेन बैरियर क्रॉस करने तो बाद जाके बैठेगा सेफ दिमाग, ओके, ब्रेन जो, क्योंकि अमोनिया इज वेरी नॉटी पर्सन, ठीक है, मतलब ठीक है, तुझे मैनू बाहर नहीं भेज दे, मैं ताड़े मेन घर च जाके अपना घर बनाऊंगा, समझे, so that will be there. Now what will be the clinical manifestation? Patient will have change in mental status, patient will have confusion, atraxia will be there, it's a clinical hallmark sign, okay, hallmark sign, liver flap is a disorder, is a neurological disorder that causes a person to lose a motor control of the certain areas of the body It commonly affects wrist, fingers. What we have to assess? We have to assess the patient's handwriting. Okay? Like patient will have not proper handwriting. Okay. And then in advanced stage, patient will go in a coma. Now, what will be the management? Management will be the electrolysis, osmotic laxative, oral or enema form we are giving to excrete the ammonia via stool. Okay. Lactulose convert the ammonia into ammonium and it is excreted through the stool. ਹੁਣ ਆਪਾਂ ਨੂੰ ਜਿਹੜਾ ਅਮੋਨੀਆ ਵਾ ਹੁਣ GI ਟਰੈਕਟ ਚ ਲੀਵਰ ਦਾ ਤੇ ਲੀਵਰ ਆਪਾਂ ਠੀਕ ਕਰਾਂਗੇ ਉਦੋਂ ਠੀਕ ਕਰਾਂਗੇ ਜਦੋਂ ਉਹਦਾ ਲੀਵਰ ਦਾ ਕੰਮ ਚਾਲੂ ਹੋਗਾ ਉਦੋਂ ਬਾਕੀ ਸਾਰਾ ਨਾਰਮਲ ਪ੍ਰੋਸੈਸ ਚਾਲੂ ਹੋਏਗਾ ਬਟ ਨਾਓ ਵੀ ਹੈਵ ਟੂ ਰਿਡਿਊਸ ਦਿਸ ਅਮੋਨੀਆ ਫਰਮ ਦ ਬੋਡੀ ਹੁਣ ਆਪਾਂ ਕੀ ਕਰਾਂਗੇ ਆਪਾਂ ਲੈਕਟੋਲੋਜ਼ ਦਵਾਂਗੇ ਲੈਕਟੋਲੋਜ਼ ਕੀ ਕਰਦਾ ਹੈ ਦਿਸ ਅਮੋਨੀਆ ਨੂੰ ਕਨਵਰਟ ਕਰਦਾ ਹੈ ਅਮੋਨੀਅਮ ਚ ਠੀਕ ਹੈ ਜਦੋਂ ਅਮੋਨੀਆ ਅਮੋਨੀਅਮ ਚ ਕਨਵਰਟ ਹੋ ਗਿਆ ਫਿਰ ਇਹ ਸਟੂਲ ਦੇ ਵਾਇਆ ਬਾਹਰ ਆ ਜਾਏਗਾ okay so when we are giving this lactulose patient will have 2 to 3 soft bowel movement okay that's a normal but we have to monitor the patient for electrolytes okay loss of electrolytes and we have to start the ringer lactate and give the oral fluids watch for diarrhea because lactulose the ਨਾਲ diarrhea ਹੋਣ ਦੇ ਬਹੁਤ chances are another drug we are giving neomycin is antibiotic prophylactic to decrease the GI bacteria. Okay, when any person, even healthy people have the E. coli in their guts. Okay, E. coli apne intestine chona, that's a common. Okay, there's no problem. But this E. coli, what they do, it produce the ammonia. Okay, E. coli ne ਜਦੋਂ E. coli ਆਪਣਾ ਸਾਹ ਲੈਂਦੇ ਆ, right? They produce the ammonia. ਹੁਣ healthy people ਚ ਤੇ ਅਮੋਨੀਆ ਕਿੱਥੇ ਚਲਾ ਜਾਏਗਾ ਲੀਵਰ ਚ ਚਲਾ ਜਾਏਗਾ there is no problem but unhealthy people liver disease ਆ ਉਹਦੇ ਚ ਇੱਕਦਮ ਪ੍ਰੋਟੀਨ ਦੇ ਨਾਲ ਜੋ ਅਮੋਨੀਆ ਬਣਿਆ ਉਹ ਔਰ ਈਕੋਲਾਈ ਵਾਲਾ ਵੀ ਅਮੋਨੀਆ ਬਣ ਰਿਹਾ so we don't want this ਈਕੋਲਾਈ ਵਾਲਾ ਅਮੋਨੀਆ so we are giving neomycin to kill this ਈਕੋਲਾਈਜ਼ okay ਤਾਂ ਕਰਕੇ ਆਪਾਂ neomycin ਲੈਂਦੇ ਆ ਈਕੋਲਾਈ kill ਕਰਨ ਵਾਸਤੇ till here any doubt Okay, perfect. Let's move on to appendicitis. Appendicitis is inflammation of appendix. Okay, it's at right lower quadrant, right lower side of the abdomen. अपने right side इतने होता है appendix. Okay. Causes of obstruction or trauma. Signs and symptoms will be remember appendix. Abdominal pain, acute pain will be there. Point of McBurney point. Where is the McBurney point? अपनी umbilicus तो go to the right side of your spine, pelvis. ਜਦੋਂ ਤੁਸੀਂ pelvis ਨੂੰ ਜਦੋਂ ਤੁਸੀਂ ਆਪਣੀ umbilicus ਤੋਂ toward the pelvis ਦੀ ਤਰਫ ਜਾਓਗੇ you will be feeling pelvis. ਤੁਹਾਨੂੰ pelvis ਆਪਣੇ ਹੱਥ ਨਾਲ ਲੱਗੇਗਾ. That is the ischial spine, iliac spine. Okay. Iliac spine de it's a 2/3 away from the umbilicus. Okay, at the ischial spine that's called as a McBurney point. Okay, anterior superior iliac spine. Okay, matlab approximately 2/3 away from the umbilicus toward the ischial spine is a McBurney point. ਉੱਥੇ patient pain ਕਰੇਗਾ pain ਉੱਥੇ complain ਕਰੇਗਾ ਕਿ ਮੇਰੇ pain ਇੱਥੇ ਹੁੰਦੀ ਆ. Patient will have the poor appetite, elevated temperature will be there, nausea and vomiting will be there, desire to be in a fetal position. ਜਦੋਂ ਦੋਨੋਂ ਪੈਰ ਆਪਣੇ abdomen ਤੇ knees ਨੂੰ hands ਨਾਲ guard ਕਰਕੇ ਬੈਠਦੇ ਆਪਾਂ that's a fetal position they will feel relief okay because they are guarding their umbilicus their appendix sorry. There will be increased WBC and CRP, C-reactive protein. ਜਦੋਂ ਵੀ infection ਹੁੰਦਾ ਉਹ increase ਹੁੰਦਾ even WBC count increase ਹੁੰਦੇ whenever we have any infection, inflammation or any stress to the body. Experiences rebound tenderness. Now when this rebound tenderness will be there when there is a rupture of perforation. Okay, that's a indication of rupture. Risks of rupture if not treated within 48 to 62 hours. Sudden stoppage of the pain is a sign and symptoms of the rupture. Rupture can cause abscess and peritonitis. Okay? Whenever you got a patient with the appendix, we are not giving any pain medicines. Okay? Because अगर आप पेन मेडिसिन देनी है पेशेंट की पेन रिलीफ होएगी विल नॉट कम टू नो कि पेन मेडिसिन ना रिलीफ हो या के peritonitis हो गए. So that's why we are not giving. This SWOT sign, reversing sign, marker signs, just read it. It's not important, but you will see somewhere in question bank. Don't worry if you remember well and good. If you're not remembering, that's fine. No one going to ask you this. Okay. Now, what will be the management of appendix? No heat, no enema, no laxative, no pain medicines. You can give the ice application and the surgery will be the treatment appendicectomy. Okay, we have to remove this appendix. That will be there. Now tell me, what is the one sign you are going to see in your patient? Peritonitis. You got a patient with the appendicitis. And after 2 hours, now patient is telling the patient don't have any pain. I'm relieved with my pain. What one sign you are going to see about the peritonitis? एक check की करोगे तुसी patient में. Write it down. You are observing patient's abdomen. Okay, assessment कर रहे हो. Inspection जो तुसी की देखोगे. Patient says, I don't have any pain now. I'm relieved. Okay. Yeah, peritonitis, one sign and symptom of peritonitis. You are doing abdomen assessment by inspection. Okay? ਤੁਸੀਂ inspection ਅੱਖਾਂ ਦੇ ਨਾਲ ਦੇਖ ਰਹੇ ਹੋ. So what one sign you are going to see? Yes, Cullen sign. Okay, now what is this Cullen sign? Cullen sign is a bluish discoloration around the umbilicus. ठीक है, पेशेंट की ਜਿਹੜੀ umbilicus ਆ ਉਹਦੇ around ਤੁਸੀਂ bluish discoloration देखोगे. Okay, that is a sign and symptoms of peritonitis. That's called as a Cullen sign. Okay, good. Okay, now next is a gastroesophageal reflexes disease, GERD. What happening in this? Stomach contains leak toward the esophagus, causing a irritation. Okay, पण जेड़ा stomach च content आ. Okay, this is our stomach. This is esophagus. Okay, now जेड़ा food वा ideally mouth तो आया, stomach से गया. Then it will be going to via the duodenum, it will be going to the intestines. But in a gastroesophageal reflexes, नाम ही तानु दस रहे हैं. Gastro तो esophageal reflex होता है. मतलब stomach content leak toward the esophagus. ਜਿਹੜਾ ਵੀ ਇੱਥੇ ਆਪਾਂ ਫੂਡ ਵਾ ਉਹ ਵਾਪਸ ਈਸੋਫੇਗਸ ਚ ਜਾਂਦਾ ਹੈ, ਇਟਸ ਗੋਇੰਗ ਟੂਵਰਡ ਦ ਈਸੋਫੇਗਸ, ਓਕੇ, ਇਹ ਇੱਧਰ ਨੂੰ ਵਾਪਸ ਜਾ ਰਹੇ। ਸੋ ਵਾਟ ਹੈਪਨਿੰਗ ਨਾਓ, ਇੱਥੇ ਕੀ ਆ, ਆਪਣਾ ਹਾਈਡਰੋਕਲੋਰਿਕ ਐਸਿਡ ਆ, ਜੋ ਵੀ ਆਪਾਂ ਖਾਇਆ ਰਾਈਟ, ਉਹ ਸਾਰਾ ਹਾਈਡਰੋਕਲੋਰਿਕ ਐਸਿਡ ਨਾਲ ਮਿਕਸ ਹੋਇਆ ਵਾਪਸ ਉੱਪਰ ਦੀ ਤਰਫ ਜਾ ਰਿਹਾ, ਤਾਂ ਇਟ ਗੋਇੰਗ ਟੂ ਇਰੀਟੇਟ ਦ ਪੇਸ਼ੈਂਟਸ ਈਸੋਫੇਗਸ। What can be a causes? Causes can be age, caffeine, alcohol, smoking, hot and spicy food, hiatal hernia. This can be anything. Okay. Now, what will be the problem? HCl acid backflow. The HCl acid backflow that will be giving the heartburn. Heartburn, the pyrosis is a term. Burning sensation in the chest, then patient will have the feeling of fullness, bloated laguga. Small frequent meal we are giving. Avoid food at a meal time. Give food 1 hour before and 1 hour after the meal. Nausea and vomiting will be there. Drug of choice will be the antiemetic. Metoclopramide, Reglan we are give or Zofran we give. Okay. Patient will have the dysphagia, difficulty in swallowing. Management will be the thickened fluid. Assist the patient in flexing the neck to have the control over the swallowing and prevent the aspiration. Thialism is an excessive salivation because what happening, patient swallow नहीं कर पाता. So बहुत सारा excessive salivation होता है. So we have to give the oral care, chew the sugarless gums or candy. You know, I got this GERD in my life one time. And you know, what was the feeling? Hi, मैंने लगा था cancer हो गया. It was that feeling I was having. It was so painful. I was doing night shifts. मैंने nights कभी nights नहीं की थी, like student life छड्डन तो बाद I never did night. And due to night shift, I got a very bad GERD, very bad. I was not able to swallow anything. मैं इतना करके swallow करती थी, and it was like horrible. Horrible means horrible. And it got treated with the PAN 40 only. I was so surprised. Like being a healthcare, we like think what happening, right? You know, the बहुत ज़्यादा tension हो गई थी. Okay. So this is GERD. जो भी stomach का content है ऊपर की तरफ आएगा, ऊपर की तरफ आने की होएगा, patient will have the all problems like irritation, burning sensation, nausea, vomiting, fullness, blotted laguga pura. Patient will have the heartburn because of that hydrochloric acid. Management kiya apano. A patient will not able to swallow because it's irritating, and that there will be like kind of inflammation due to the HCl irritation found karke. So we have to thicken the fluid and we have to ask them to flex the neck and swallow. Okay. Now, hiatal hernia or dumping syndrome. I put it side to side purposefully because when we are doing now, we will be doing one by one. But when you are reviewing your notes, you have to do compare it. Okay, because ये दोनों opposite होता है. Okay, दोनों चीजें opposite चीज होगी. Okay, so you have to compare, but we are going to do one by one. Okay. Hiatal hernia. A hiatal hernia is also known as esophageal or diaphragmatic hernia. The portion of the stomach herniates through the diaphragm into the thorax. Okay. So, as you see, this is a normal. Esophagus. Here is a esophageal sphincter. Okay. A sphincter की काम करता है. It will not allow content to go back. जो sphincter loose हो जावे, that time we have the problems. Okay, this is a diaphragm. Okay, now what happening here in a hiatal hernia? Stomach is getting herniated through this diaphragm. This जो stomach da part है, उत्ते दी तरफ जाता है. That's called as a hiatal hernia. Okay, stomach da part उत्ते दी तरफ चला गया. Okay, because of this diaphragm. Okay, इनो cross करके ऊपर दी तरफ चला गया. That's a thing. Okay. Now, what will be the patient will have regurgitation or acid into esophagus because upper stomach herniated toward herniates upward through the diaphragm. The gastric contents move in a wrong direction, up instead of down at the correct rate. ਹੁਣ ਇਹ 'ਚ ਕੀ ਹੁੰਦਾ ਹੈ? ਆਈਡੀਅਲ ਸਿਚੁਏਸ਼ਨ 'ਚ ਆਪਾਂ ਕੁਝ ਵੀ ਖਾਇਆ, ਉਹਨੇ ਥੱਲੇ ਜਾਣਾ, ਇੱਥੇ ਜਾਣਾ, ਫਿਰ intestines ਜਾਣਾ. Okay, that is the ideal situation. But when patient have the hiatal hernia, okay, now, okay, this is a herniated pouch. Okay, ਫਿਰ ਇੱਥੇ stomach ਆ ਗਈ. Okay, ਹੁਣ ਇਹਦੇ 'ਚ ਕੀ ਹੁੰਦਾ ਹੈ? Patient food ਖਾਇਆ, ਥੱਲੇ ਆਇਆ, okay, ਇਹ normal ਆ. But due to the disease or problem, ਇੱਥੇ ਤਾਂ ਜੋ ਵੀ food contain ਆ ਵਾਪਿਸ ਉੱਪਰ ਦੀ ਤਰਫ ਜਾਂਦਾ ਹੈ. Okay, ideally ਥੱਲੇ ਜਾਣਾ ਹੀ, but wrong direction 'ਚ ਉੱਪਰ ਜਾ ਰਿਹਾ ਹੈ. Okay, going up in a correct rate. ਠੀਕ ਹੈ, ਜੋ rate ਨਾਲ ਜਾਣਾ ਉਹਦੇ ਨਾਲ ਹੀ ਜਾ ਰਿਹਾ, fast ਨਹੀਂ ਜਾ ਰਿਹਾ. Okay, so what will be the patient have the problem? Patient will have all upper GI problem, right? अपना इत्थे तक अपना upper GI आ. Okay, patient will have indigestion, heartburn, GRD because उत्तर दी तरफ जा रहे हैं ना, regurgitation हो रहा है, vomiting होएगा, chest pain, dysphagia, feeling of fullness होएगा. Okay, that will be there. Now what will be the management? Management will be the raise the head of bed during and 1 hour after the meal. ठीक है, पेशेंट खाएगा भी रोटी अपराइट पोजीशन च और 1 घंटा बाद भी अपराइट रहेगा because it has to go down. Okay, it up नहीं आना चाहिए, down जाना चाहिए. We have to give high fluids, high carbohydrates, decrease protein, avoid anticholinergic drugs which delay the stomach empty. Okay, कोई भी ड्रग ਇਹੋ ਜਿਹੀ ਨਹੀਂ ਦੇਣੀ ਹੈ ਜੋ stomach empty ਨੂੰ delay करे. We need the empty of the stomach on a regular time, right? ठीक है, stomach ਦਾ ਜੋ ਵੀ content ਆ ਉਹ ਥੱਲੇ ਜਾਣਾ ਚਾਹੀਦਾ ਹੈ. Okay, that we require. So we are not giving anything which delay the stomach emptying. Okay, that will be there. Now, in the dumping syndrome, what happening? Dumping syndrome is a complication of gastric surgery. ठीक है, एते होया due to maybe diaphragm loose या कोई problem हो गई, like that kind of, right? That's why this hiatal hernia is occurring. But this dumping syndrome is a complication of post-operative surgery. ਇਹ 'ਚ ਕੀ ਹੁੰਦਾ ਹੈ? ਇਹ 'ਚ ਕੀ ਹੁੰਦਾ, ਜੋ ਵੀ ਫੂਡ ਆਪਾਂ ਖਾਇਆ ਪੇਸ਼ੈਂਟ ਨੇ, ਉਹ as patient took the food, it goes directly to the duodenum. Gastric contents move in the correct position, correct direction. अपन थल्ले जाना है, correct होया. But उन्हें थोड़े time च जाना है, but it's fast movement हो रही है, directly going into the duodenum. Okay, as I told you, this is a complication of the surgery. That's weight management surgery. Okay, gastric surgery. What they do in a gastric surgery? They cut the portion of the stomach. This is this called as a sleeves gastrectomy. Okay, ਇਹਦੇ 'ਚ ਕੀ ਕਰਦੇ ਆ, ਜੋ stomach ਦਾ part ਆ, this is the normal stomach. Okay, this is example normal stomach. So patient who wanted a weight management study, surgery, reduce the weight, what they do, they cut this part, the portion of the stomach they cut, ਹੁਣ ਕੀ ਹੋ ਗਿਆ, ਸਟਮਕ ਬਹੁਤ ਛੋਟੀ ਰਹਿ ਗਈ ਤੇ food is not staying, it's going directly to the duodenum, it's getting dump to the duodenum, ਠੀਕ ਹੈ। ਆਪਾਂ ਇੱਕ ਚੀਜ਼ ਡੰਪ ਕਰਦੇ ਆ ਨਾ, that's why it's called as a dumping syndrome। ਫੂਡ ਇੱਥੇ ਰੁਕ ਨਹੀਂ ਰਿਹਾ, ਡੰਪ ਹੋ ਰਿਹਾ ਡਾਇਰੈਕਟਲੀ ਡਿਓਡਿਨਮ ਚ, ਓਕੇ, that will be clear। Now, gastric contents dumps too quickly into the duodenum. Gastric contents move in a correct direction at the wrong rate. ਹੁਣ ਇਹਦੇ ਸਾਈਨ ਐਂਡ ਸਿਮਟਮ ਕਿੱਥੇ ਹੋਏਗੇ, ਲੋਅਰ GI systems, okay, because duodenum ਤੋਂ ਬਾਅਦ ਆਪਾਂ ਨੂੰ ਲੋਅਰ GI tract consider ਕਰਦੇ ਹਾਂ। Acute lower abdominal distress, diarrhea, cramping, leg, gas, abdominal pain, cramping, guarding. Okay, ਜਦੋਂ guard ਕਰਦਾ ਹੈ, they will be feeling good. Splinting, rigidity, distended, diarrhea leads to the dehydration. Patient will have the drunk look. Okay, why this drunk look will be there? All blood going to the guts, not to the brain. ठीक है, जितना ही patient ने food खाया directly duodenum ਚ गया, so what all blood is taken by the intestine to digest that food, okay, so brain ਚ oxygen supply नहीं गया, that's why they will be confused, and then they will go in a shock। Now what will be the management? Management will be the low head of the bed during and 1 hour after the meal। आपका patient ਨੂੰ लेटा के खाना खिलाना है, okay, patient has to be in a lying down position। low restricted fluids at the meal time, ਆਪਾਂ meal time ਚ ਆਪਾਂ fluid restriction ਦਿੰਦੇ ਆ। low carbohydrate, increase protein and fat, it takes long time for digestion। fat will take long time in the stomach to get digest, protein will take, but carbohydrate बहुत जल्दी digest ਹੁੰਦਾ है, so we have to avoid the carbohydrate, and protein and fat we have to do, that will be there। I will try to wind up this in 15 to 20 minutes because many of the things are moreover going through. Wherever I feel like, yes, whatever things are need to be explained very brief, detailed, I will do that. Let's see, 15 minutes will take more. 10, 15, let's see up to 10, 15, how much we are covering, and then we will wind up, okay? Next is ulcerative colitis. Ulcerative colitis is inflammation of the large intestines. Okay. So ਇਹਦੇ ਚ ਕੀ ਹੁੰਦਾ ਹੈ, large intestines inflammation ਹੁੰਦੀ ਹੈ, okay. What you have to remember the clinical manifestation by ulcer. Urgent frequent needs to have a bowel movement, severe diarrhea, pus, mucus and blood will be there. Loss of weight due to constant diarrhea and low red blood cell, patient will have the anemia. Cramps in abdomen, very painful. Electrolyte imbalance due to dehydration and elevated temperature will be there. Rectal bleeding will be there. Stool with blood will be there. Okay. Another problem is a Crohn's disease. Crohn's disease is inflammation and erosion of the ileum and anywhere throughout the small and large intestine. Mainly, usually hunda hai ileum ch, but it can happen in any place. Okay. So, ਇਹਦੇ ਚ ਕੀ ਹੁੰਦਾ ਹੈ, there will be ulcerative colitis ਚ ਸਿਰਫ ਇੱਕ inflammation ਹੈ, okay. There will be one inflammation in the colon. Okay? As you see, this is a normal colon and over here there is a inflammation. This is a ulcerative colitis. This means inflammation. Now, Crohn's disease, what is the difference? इत्थे erosion हो गया, इत्थे wound हो गया. Okay, this is a wound. In a commonly happening in the ileum, but it can happen in any place of the small or large intestine. Okay. Now, for Crohn's disease, there will be the abdominal pain, mainly located in the right lower side due to inflammation and possible stenosis. Patient will have ulcer in mouth or GI tract. Diarrhea will be there, maybe have the blood, mucus, blood from the common of ulcerative colitis, but it's very, but it can be present in the Crohn's disease also. A loss of appetites and weight, weight will be lost because of malnutrition, electrolyte imbalance, dehydration. Remember, the small intestines are not working due to the inflammation. Okay, small intestine ਚ ਆਪਣਾ water रीअब्जॉर्प्शन बहुत ਹੁੰਦਾ ਹੈ ਜਿੰਨਾ ਵੀ ਆਪਾਂ ਪਾਣੀ ਪੀਂਦੇ ਉਹਦੀ ਰੀਅਬਜ਼ॉर्प्शन ਜ਼ਿਆਦਾ ਤੋਂ ਜ਼ਿਆਦਾ ਆਪਣੀ small intestine ਚ ਹੁੰਦੀ ਆ so small intestine is not working so dehydration will be there water reabsorb नहीं होएगा okay fissure anal will be there so if there is a fissures in anus we have to watch for bleeding blotting of abdomen will be there due to the inflammation. Now, what will be the management for both? There is no cure. Okay, the cure नहीं है. Colitis का भी and Crohn's disease का कोई cure नहीं है. We have to give the low fiber diet, avoid cold and hot food, no smoking, antidiarrheal we have to give, antibiotic we have to give, steroids we have to give, and surgical management. On surgical management depend on the area where the ulcer or colitis is there or Crohn's disease is there, we are doing. If there is a ileostomy and there is a colostomy. We'll see the ileostomy and colostomy details in the upcoming slides. Okay, so surgical management is only the treatment for this kind of diseases. Okay, now next is a diverticular disease. Now in diverticular disease, there is a diverticulosis and there is a diverticulitis. Diverticulitis is the inflammation of diverticulum. Itis is a inflammation, right? Hence the herniated sac become the inflamed. More is discussed below. Like, sorry, this line is there. This can lead to the abscess, rupture of the diverticula, which leads to the peritonitis and the sepsis. Okay. I will just tell you, just wait. Now now see the diverticulosis. Diverticulosis is a formation of the hollow sac cavity throughout the intestinal wall. This outpouching sac can form anywhere throughout the intestine, but are most commonly found in a sigmoid colon of the large intestine. Okay. And ਆਪਾਂ ਇਹਨੂੰ ਦੇਖਦੇ ਹਾਂ ਕੀ ਹੁੰਦਾ ਹੈ okay okay this is the intestines right so what happening in a diverticulosis there will be the pouch formation usually it happen in a sigmoid colon very commonly but it can occur in anywhere in a large intestine so ਇਹਦੇ ਚ ਕੀ ਹੋਏਗਾ ਇੱਕ pouch formation ਹੋ ਜਾਏਗਾ like this okay intestinal okay now it एक pouch formation हो गई that is a diverticulosis सिर्फ एक pouch formation हुई है okay now food is going आपने तो खादा तो जो भी enzyme mix होना है सब होना है digestion started food is coming here okay on food कदी कदी डायरेक्टली भी चला जाएगा कदी कदी फूड जाके इथे रुक जाएगा okay now this food will get inflammation right that time this pouch will get inflammation that's called as a diverticulitis ਹੁਣ ਇੱਥੇ ਜਿਹੜੀ ਜੋ ਸੈਕ ਬਣਿਆ ਸੀ okay ਉਹਦੇ ਵਿੱਚ ਇਨਫੈਕਸ਼ਨ ਚਾਲੂ ਹੋ ਗਈ because food gone there ਉਥੋਂ ਵਾਪਸ ਬਾਹਰ ਨਹੀਂ ਆਇਆ and this can get rupture also okay a rupture भी हो सकता है and then patient will lead to peritonitis and sepsis okay that will be there now what will be the clinical manifestation clinical manifestation is a change in bowel pattern sudden constipation sudden diarrhea will be there abdominal bloating will be there what you have to remember just remember the pouch pain in abdomen mainly in the lower quadrant left lower quadrant Observe the abdominal blotting and a blood in stool. Unrelating crampings, tight pain, because there will be no reason for cramping, but patient is getting cramps. Constipation will be there, high temperature will be there. High temperature कदों होएगा जब diverticulitis आ जब inflammation हो गया जित उथे food रहा food infected हो गया inflammation occurs हो गई patient will have the fever. Now what will be the complication of this problem? Diverticular bleeding will be there. For diverticulosis there can be a diverticulitis also. Okay. After the diverticulitis, there can be abscess, herniation of pouch become full of infection and is swollen with a pulse. Patient will have the major symptoms, fever, WBC count high hoega, intense abdominal pain, nausea, vomiting, rupture of this diverticulum. When there will be the rupture, sac tears open and split it contains into the abdomen and that will leads to the peritonitis. Obstruction due to the inflammation of the tissue or scarring of the tissue will be occurred. Fistula formation can occur. Okay. Fistula will be with the intestine and other organ. There can be a fistula formation. Okay. Now I'm going both the same time. Okay. So don't get confused. Diverticulosis causes will be unknown, possibility due to the increased pressure in a colon due to the constipation and straining. Pouch formation कਦੋਂ ਹੁੰਦਾ है? When there will be some pressure. Okay, पहला they don't know what will be the cause. Otherwise, sometimes if there is a continued constipation, patient low fat diet habitat, increased age, and family history. Diverticulitis the complication की again unknown. इथों जी patient diverticulosis तो हो सकता है diverticulitis, inflammation हो सकती है. Stool getting stuck in a herniation pouch. Stool or food can be getting herniation pouch. Low fiber diet. Then increased pressure in a colon causes a tear in a diverticulum, which can lead to infection and inflammation. This allows the bacteria to migrate in the outpouching and causes the infection. जेड़ा pouch बनया वा, right? ਉਹਦੇ ਚ food या ਜਿਹੜਾ intestine ਤੇ pouch ਬਣਿਆ ਉਹਦੇ ਚ food or stool can be, it's a depend on ਕਿਹੜੇ area ਚ, right? Will be accumulated and then whenever there is a pressure or anything, it can be burst also. Okay, that will be clear. Now what will be the management? Avoid constipation. Diet will be the high fiber diet, increase oral intake, avoid milk. When there is a infection, we have to, whenever patient is in attack, acute attack, nil by mouth रखेंगे, bowel rest देंगे, TPN or nasogastric tube we can give. Usually patient will go with the total parental nutrition. Okay, TPN. Complete bed rest will be there. Colostomy surgery will be there. Okay. Now regarding the TPN, okay, total parental nutrition. Main thing ਆਪਾਂ ਇੱਥੇ ਕੀ ਯਾਦ ਰੱਖਦੇ ਹਾਂ, patients are more prone for infection. ਠੀਕ ਹੈ. TPN ਤੇ there will be 2 or 3 question in your question bank. ਉਹਦੀ ਪੂਰੀ explanation you have to write it down in your notes. Okay, that's only is important. Majorly TPN ਤੇ question ਆਏਗਾ, it will be related to infection only because TPN is we are giving via the central line and they are more prone for infection. Now next is a colostomy. This is a very important highlight. ਇਹਦੇ ਤੇ question ਆਏਗਾ. Okay. Surgical opening into the colon called as a stoma. It may be temporary or it can be permanent. A surgical procedure that brings on the end of the colon throughout the abdominal wall. Okay. ये abdominal wall आ, okay. इथे पीछे अपने intestine सा colon आ. There is a problem. We are doing some surgery. It can be a temporary or it can be a permanent. We are making the incision on a wall of the abdomen. Then this intestine we are pulling through this and we are making one stoma. Okay. What is stoma? Okay. This is your patient stoma. From this stoma, you will be getting stool, okay, or some drain. Stool moving through the intestine, drain through the stoma into the bag. इथे आपण एक bag ला देंगे बच्चों, okay? Bag which attached to the abdomen. You have to empty the bag when it's 1/3 full. Now, as a nurse, you should know the stoma is healthy or not. Your patient's stoma is healthy or not. How the healthy stoma will look like? Everyone see your chick inside your mouth. ठीक है? अपना chick देखो. How it look like? Stoma has to be look like same. It has to be look like pink to red. Warm, moist, secrete small amount of mucus. Yeah. As I told you, we have exocrine glands which secrete the mucus to keep our system moist. ठीक है, ताही अपने system काम कर दिया क्योंकि वो moist ਹੁੰਦੇ ਆ. ठीक है. Same way, GI tract have the mucus, so this intestine or this stoma will be always moist. ठीक है. It has to be in an oval shape. No nerve ending. Stoma te koi bhi nerve ending nahi hoegi, so patient will not have the pain. Okay. Look large edematous at the start of stoma. जितन सर्जरी की थी उधर ये काफी edematous लगेगा. But it will go in a final size into 6 to 8 weeks time. 8 weeks तक आने तक उधर size कट जाएगा. Okay, that will be the final size. When you are going to notify the physician when your stoma is not healthy. Now, what will be the unhealthy stoma sign and symptoms? It will be dark blue color, purple, black stoma. What it means? Blood circulation nahi ja raha. Need immediate surgeon notification. If the stoma appears dark and dusty, it's indicate necrosis. Monitor for prolapsed or retracted stoma. Sometimes जिन्ना बाहर होना चाहिए था उस तो ज्यादा बाहर आ. That's called as a prolapse of the stoma. Sometimes जिन्ना बाहर होना चाहिए था उस तो कट बाहर आ, like अंदर दी तरफ ज्यादा है. That's a retracted stoma. So that also we have to inform to the doctor. Okay. Okay. In healthy stoma, one more thing you have to remember, there is no wall. अपने GI intestine से कोई walls नहीं होती हैं. Okay. There is कोई walls नहीं है to shut the muscles. वो continue peristaltic movement होंदे रहंदे हैं. जितना ही peristaltic movement होएगे, what we are going to get in a stoma, we are going to get some form of stool. ठीक है, वो continue आएगी. ठीक है, so there will be continue some secretion or stool in the stoma. Okay, so no control on a passage of stool from the stoma. Now, depend on the location, what consistency of the stool you are going to get. तनु केहो जी stool मिलेगी, or depend on that पूरी अपने stoma दी location पे. Just 2 minutes. Just a second. Okay. Okay. So, now consistency of the stool means stool मतलब लिक्विड होएगी, सेमी लिक्विड मशी और पल्पी होएगी या सॉलिड होएगी, लाइक लुक लाइक नॉर्मल स्टूल. ठीक है, टोटली डिपेंड है कि स्टोमा कितने हैं. ओके, एज यू सी दिस इज आवर स्टमक. ओके आ अपनी स्मॉल इंटेस्टाइन है ओके विच वाली ਜਿਹੜੀ ਹੈ स्मॉल इंटेस्टाइन ਆ ਬਾਹਰ ਵਾਲੀ ਜਿਹੜੀ ਹੈ ਲਾਰਜ ਇੰਟੈਸਟਾਈਨ ਜਦੋਂ ਫਲੂਡ ਆਪਾਂ ਜਦੋਂ ਫੂਡ ਆਂਦਾ ਹੈ ਇਟ ਗੋਜ਼ ਇਨ ਅ ਸਮॉल ਇੰਟੈਸਟਾਈਨ ਓਕੇ ਸਮॉल ਇੰਟੈਸਟਾਈਨ ਤੋਂ ਇਥੋਂ ਜੀ ਫੂਡ ਆਇਆ ਓਕੇ ਨਾउ ਦਿਸ ਪਿੰਕ ਇਜ਼ ਅ ਫੂਡ ਯਾ ਇਥੋਂ ਆਇਆ ਸਮॉल ਇੰਟੈਸਟਾਈਨ ਚ ਘੁੰਮਿਆ 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 ਓਕੇ okay so if it is a ileostomy okay ileum is over here somewhere ठीक है अगर ते ileostomy है it will be frequent and liquid okay frequent and liquid stool will be there okay then it goes to the ascending colon फिर इथों जी आया it goes in the ascending colon आ वाला large intestine दा आ ascending colon ना ठीक है when if it is stoma is on an ascending colon again it will be fluid and liquid stool ठीक है when it will be on a transverse colon okay it will be mushy and pulpy okay ਇੱਥੇ ਤੱਕ ਆਂਦੇ ਆਂਦੇ ਤੱਕ mushy and pulpy ਹੋਏਗਾ okay now when it comes to the descending colon okay ਇੱਥੇ ਤੱਕ ਆਂਦੇ ਆਂਦੇ ਤੱਕ it will be a semi solid okay and if comes to the sigmoid colon okay ਆ sigmoid colon ਹੈ ਅਗਰ sigmoid colon ਦੇ ਇੱਥੇ stoma ਵਾ then it will be almost near to the stool formation ਕਿਉਂਕਿ ਇੱਥੇ ਤੱਕ ਆਂਦੇ ਆਂਦੇ ਤੱਕ almost stool ਬਣ ਗਈ ਹੁੰਦੀ ਆ okay and because ਇੱਥੇ ਤੱਕ ਆਏਗਾ ਬਾਅਦ ਚੋਂ via the rectum and the anus ਤੋਂ stool normal ਚ ਪਾਸ ਕਰ ਦੇਗਾ patient if it is a sigmoid colon ਤੇ colostomy ਹੋਏਗੀ it will be near now absorption of water and nutrients are food passes from the small intestine to the rectum हर जगह ਤੇ कुछ ना कुछ हो रहा है every place the food is getting absorbed water is getting absorbed and all but ਜਦੋਂ ਤੱਕ ਆਪਣੇ ਇੱਥੇ ਆਂਦਾ ਹੈ ਇਲੀਓਸਟੋਮਿਕ ਇਲੀਅਮ ਤੱਕ ਆਂਦਾ ਹੈ ਇਲੀਅਮ ਤੱਕ ਆਲਮੋਸਟ ਇੱਥੋਂ ਜੀ ਜੋ ਵੀ ਆਪਾਂ ਖਾਣਾ ਖਾਇਆ ਸਾਰਾ ਖਾਣਾ ਮਿਕਸ ਹੁੰਦਾ ਹਾਈਡਰੋਕਲੋਰਿਕ ਐਸਿਡ ਚ ਐਂਡ ਅਦਰ ਐਂਜ਼ਾਈਮਸ ਆਪਾਂ ਨੇ ਐਗਜ਼ਾਮਪਲ ਆਪਾਂ ਨੇ ਰੋਟੀ ਖਾਦੀ ਰਾਈਸ ਖਾਦੀ ਉਹ ਸਾਰੇ ਬਣ ਗਏ ਲਿਕੁਇਡ ਫਾਰਮ ਚ ਓਕੇ ਫਿਰ ਲਿਕੁਇਡ ਫਾਰਮ ਚ ਬਣ ਗਏ ਫਿਰ ਥੱਲੇ ਗਏ ਹਜੇ ਸਟਿਲ ਇਹ ਲਿਕੁਇਡ ਹੀ ਆ it's getting absorbed so that's why we are getting a liquid and why it's a frequent because ਜਿੱਦਾਂ ਹੀ ਆਪਾਂ ਖਾ ਰਹੇ ਹਾਂ after in a 30 minute to 40 minute it started going down ਤਾਂ ਕਰਕੇ ਉਹ frequent ਆ ਰਹੇ ਹੈ ਕੁਛ ਨਾ ਕੁਛ right so that's why it's a frequent so we have to see where is the stoma according to the stoma it will be the characteristics or consistency of the stool will be there okay and this is very important remember this because you are teaching this to the patient apane health education deni hai that's why it's important this is a nursing care okay now one more nursing care one more question is expected with the colostomy that your patient is on a colostomy and while you are going and telling the patient hey I wanted to teach you about the care of the colostomy patient is telling I'm not going to do that bloody work my wife will take care of that what that means your patient is not ready to see the stoma is not ready in a sense of mental health okay then you have to choose the answer appropriately जो भी mental health ਦੇ related होगा ਆਪਾਂ ਉਹ करना है sometimes we say it's okay we teach to the partner okay because as of now patient is not ready because बहुत ਵੱਡਾ body ਚ system ਚ change आया है मेरे appearance ਚ change आया है patient will have the mental health issue okay we have to talk to the patient if they are not ready we have to give the space to them okay and we have to take into the consideration yes they will be having some body image changes okay that is very important okay now next is a I'll try to wind up I really don't want to keep or you guys want to see in a next class, because it's going again in a next sessions. I really want to. If you allow me, I will take 10 more minutes, because otherwise, now, next class. Okay. So next class, anyway, next class is going to be a 2 sessions again. Next up, a cardio लवांगे. Okay, cardios will be always 2 sessions. फिर आप ऐसा करेंगे, we'll take 15 minutes of GI. ਆਪਾਂ rush करेंगे, because again this is almost understanding. ਇਹਦੇ ਚ ਸਿਰਫ 1-2 points ਆ ਜੋ ਆਪਾਂ ਬਹੁਤ ਮੈਂ ਤੁਹਾਨੂੰ details ਦੱਸੂਗੀ. Rest all diarrhea, lactose intolerance and all, everything is fast rush ਕਰਨ ਵਾਲੇ topics ਆ. ठीक है? Only gallbladder का जो है that we have to understand. Rest होते चलिएगा. Okay, so we'll do in the next session. Okay. Related to your notes. Okay. I saw now that just let me off the recording. Yeah.